So, assisting the patient to eat, first you want to just verify that the diet is what is prescribed to the patient. And you want to then perform hand hygiene, put on any gloves or any PPE that you may need. And then you want to explain the procedure to your patient, which, assisting with eating, pretty self-explanatory. Then you want to assess your patient to make sure that there's no any like physical limitations or neurologic limitations or anything like that with your patient is really anything's occurring really. Then you want to go ahead and just pull the curtain and assess the abdomen, assess their swallowing, make sure that everything's ready to go to eat food and that it's safe. Then you want to go ahead and just move the patient up in bed to the Fowler's position. Then you want to go ahead and just open up the curtain back, and you can go ahead and start feeding them their food. Before you feed them their food, you just want to make sure that everything is correct, make sure it's the correct diet, make sure if there's things that need to be cut up, you cut them up. And then obviously if you want, you could put like a protective towel or some type of towel over them to help them, not make a mess, or also just, just for protection in general. Then something else that you would like to do is just if you can, just sit by the patient while they're eating. You never know, they could choke, something could happen, they may need your assistance, but they also just may like to be talked to or something like that. Just give enough time to eat, and make sure that everything is good. Now whenever they're done eating, or if they say that they're full, take the tray away, take away all all the foods, and just write down the amount of food that was consumed, any liquids, anything like that, that way you can measure their input and output. And once that's done, you discard all the food, go ahead and reposition the patient, assist them with any cleaning of oral cleansing or anything like that, and then you can go ahead and just wash your hands, remove your PPE, and go on through your day.